So thank you for the videos for this initiative. I'm Aziza MENOUNI, PhD student at Moulay Ismail University and the CAU 11. I'm also program manager of the Institutional University Cooperation Program of LIRIOS at Moulay Ismail University of Meknes. I'm pleased to be here among you to present our MAROCOVID study, which targeted the impacts on the environment and the well-being in Morocco. So as you all know, in December 2019 in Wuhan, a novel coronavirus pandemic emerged. In February 11th, WHO named the virus as COVID-19. On March 2nd, Morocco confirmed its first case of coronavirus. And then on March 11, COVID-19 had been declared as a pandemic by WHO. Immediately on March 14, the Moroccan government had launched a health emergency state, and it includes a framework of regulations, restrictions of movement, and suspension of activities in public spaces. And the lockdown was a measure within this framework. Until the 22nd of November, COVID-19 caused more than 55.5 million confirmed cases in more than 232 countries, with more than 1.3 million confirmed deaths across the globe. Unfortunately, or fortunately, I don't know, Morocco has registered 320,000 cases, more than 320,000 cases, confirmed cases, and more than 5,000 deaths. I just want you to remember the date of 14 March, because this is when we started brainstorming about possible efforts from our side to support the frontline workers as young researchers and scientists. So back in March, and given the lack of any vaccine or specific therapeutic against the COVID-19, keeping mortality as low as possible was like the highest priority for all health systems. In turn, during the early stages of spread of the pandemic, Moroccan government implemented a number of mitigation measures to prevent person-to-person spread of disease. So changing people's safety measures related to behavior across the community as a method for flattening the peak has demonstrated to be useful in a previous study to containing infectious diseases. So in joining these efforts of the Moroccan government, we at the cluster of competence on health and environment at Moulay Ismail University initiated a Moroccan COVID-19 snapshot monitoring study at the start of the outbreak with three main objectives. First, to assess whether knowledge, attitude, and perceptions of COVID-19 might predict changes in behavior among general public. Second, to evaluate the magnitude of mental health outcomes and associated factors among the general population. And finally, to understand the indirect impact on the environment. So let's start first with the first objective. So in order to achieve the objective, a cross-sectional online survey was conducted from 13 March until April 20, like 10 days immediately after the lockdown were announced in Morocco. So this survey included questions about recent behaviors of general population in relation to the COVID-19 outbreak, their knowledge, attitude, and their perception. Relying on social network, an online questionnaire was spread via the university website, mass mailing, Facebook, WhatsApp, Instagram, Twitter, LinkedIn, using sponsored social network advertisements. Concerning behavior, so participants were asked, Concerning behaviors, participants were asked 10 questions about recent behaviors in relation to the COVID-19 outbreak. Some regarding the behaviors that have been recommended by WHO and the Moroccan government, and was mainly related to adequate hand hygiene, respiratory hygiene, social distancing, and avoiding any traveling. And two others related to activities that had not been recommended. For example, like taking alternative supplements, vitamin C, zinc, or some medicinal herbs, ginger, curcuma, clove oil, and so on, and following a healthy diet to boost immune system. Regarding knowledge, so a COVID-19 knowledge questionnaire had 16 questions, 4 regarding COVID-19 nature and treatment, 3 concerning transmission routes, 7 concerning main signs and symptoms, and 2 concerning the incubation period of the virus. Attitudes toward COVID-19 were also measured by 5 questions. Participants were asked about their beliefs if a specific action like wearing a face mask or washing their hands reduce the risk of catching the virus. Finally, to assess the perceptions of the general population, 19 items were used to evaluate key themes of how people perceived the COVID-19 outbreak. So we have 3 items to assess the severity of the illness, like I think that COVID-19 puts several threats to human health. 4 items to assess trust in the authorities and if they are acting in the public's interest in dealing with COVID-19. 4 subjective norms, 4 questions related to the timeline of the outbreak, and 3 regarding the influence of the media in raising awareness. So regarding the results, here you have the results of the descriptive statistics of our study. As you can see, a total of 40,158 participants submitted the survey questionnaire, and among the respondents, 63.7 were women, 73.7 aged from 25 to 54, and 86.2 held a bachelor degree or above. Regarding the safety behavioral response reported in response to the COVID-19 pandemic, avoiding going out was the most commonly safety behavior practice, followed by increasing the amount people clean or disinfect things that they might touch. Also, we remark that the majority of the participants adopted more than 6 of these safety behaviors. Regarding knowledge assessment, 85.2 were aware that the disease is contagious. 96 and 95 have a good knowledge about COVID-19 transmission routes and the principal symptoms like fever, cough, breathing difficulties, and sore throats. Concerning the attitude, 84.4% strongly agree that avoiding going out reduce the risk of catching COVID-19 pandemic, and 49.6 strongly agree that using gloves, face mask will have a positive effect on their health. However, only 28% think following a healthy diet boosts their immune system to fight against the COVID-19. Arriving to the association between personal variables and safety behavior. The table here shows that being a woman, married, having a chronic disease, and parents of children were significantly more likely to adopt more than 6 safety behavior. The strongest behavior the strongest predictor for behavior change were for participants aged 55 to 64, who are significantly more likely than other groups to follow these safety behaviors. The last one is the standardized path coefficient analysis of the factors that directly and indirectly affect public safety behaviors and explain variances during COVID-19 outbreak. So the basic model of the safety behaviors showed that the safety behaviors of the surveyed participants were greatly influenced by media, moderately influenced by the severity of the illness and confidence in the authorities, and weakly influenced by the timeline of the pandemic and subjective norms. So for the COVID-19 outbreak to be controlled, as a first conclusion of our studies, of our results, which are under publication, both government, media, and community efforts need to be taken into consideration. The increase of knowledge and attitude have a strong contribution to the control of the pandemic, for sure. But the efforts should not only be limited to the surveillance of hospital transmission, but should also monitor changes in the perceptions and behavior of the population. Arriving now to the second objective of our study. So as you all know, people exposed to coronavirus and series of imperative containment measures could be psychologically stressed. We are not used to these unprecedented circumstances. So yet the burden on the factors associated with mental health symptoms remained unclear. So the objective of this second part was to assess or to investigate the prevalence and risk factors associated with mental health symptoms in the general population. A cross-sectional study was conducted, again from March 13 to April 10th, 10 days immediately after the lockdown. We had, of course, the approval from the ethics committee locally. And because it wasn't feasible to do a national sampling survey during this special period, the survey was also conducted online. A convenient sampling method was used, and the members or the participants voluntarily responded to the survey until the convenient sample covered the 12 regions in Morocco. So through the questionnaire, we focused on symptoms of depression, anxiety, and insomnia, using respectively the 9 items patient's health questionnaire, PHQ-9, the 7-item generalized anxiety disorder scale, GAD-7, and the 7-item insomnia severity index. So just I want to highlight that the categories were based on values established in the literature, and participants were classified as having severe symptoms according to for the PHQ-5, they needed to have at least 15 on the scale, at least 15 on the GAT-7, and at least 22 on the insomnia severity index. So here you have the results of the demographic and occupational characteristics of the participants. 65.8 were women, so women responded for both questionnaires more than men. 49, more than 70% aged above 25 years old, and 49.8 are married, with 69 having children aged 5 years and more. Almost 90% of the participants had the highest level of education. Maybe it's explained by the fact that it was online, and we advertised it mainly on university websites and social media. 32% of participants had a chronic disease. 53.3 were effectively quarantined during the lockdown in Morocco. So, and the survey included only 119 participants with confirmed cases of COVID-19. So for the severity categories, severity of measurements and associated factors, considerable proportion of participants had symptoms of depression, with mild to moderate depression, and 12% with severe depression. Regarding anxiety, 39.3% had mild to moderate anxiety, and 10.5% had severe one. For insomnia, 35.6 had moderate insomnia, and only 4% had a severe one. So women, married, unemployed, and students experienced a more severe level of depression, anxiety, and insomnia, as reported in our findings. Regarding the risk factors, a multivariable regression analysis showed that being women, married, were associated with severe symptoms of depression, anxiety, and insomnia. Individuals with lower income levels had at least twice the risk for the 3 mental health symptoms compared with the high income levels people. So our findings suggest that the pandemic may have severe mental health repercussions in Morocco, as it was reported in China and in several other countries around the world. It's true that associations between mental health symptoms and risk factors cannot necessarily be considered as a causal relationship, but the results may only reflect mental health status during the epidemic. So like follow-up studies are needed to dig deeper in the possible long-term mental health effects or outcomes associated with the pandemic. Now we move to the last objective of our study. So considering the huge decrease in air pollution following the lockdown in Morocco and around the world, the COVID-19 pandemic might paradoxically have a positive effect on the environment. So in its third axis, our MAROCOVID study aims to understand the indirect impact of the lockdown on air quality. This is mainly achieved by gathering concentrations of main pollutants from the databases from the Department of Environment in Morocco and published data of the ozone monitoring instruments, which is a Dutch-Finnish monitoring image spectrometer meant for distinguishing ozone and other atmospheric species. So the trace gauges measured include ozone, SO2, NO2, and aerosol optical depth. So the monthly average data from January to May in the years of 2019 and then 2020 were used for this study. During the processing and interpretation of satellite data, mainly for mapping GIS, like ArcGIS has been used, and we calculated an index of pollution by subtracting the value of 2020 from the monthly value of 2019. And this index was then represented on maps, as you can see. So you know that sulfate dioxide is one of the important indicators of air pollution, strongly related to the combustion of petroleum and chemical fuels. For the present study, the variations in SO2 concentrations were not very high, maybe because its levels appeared quite variable and significantly have decreased in the 20 or the 10 last years in Morocco of fuel, because of fuel and lubricant oil with low sulfur content. The ozone level has slightly reduced, as you can see with the values here on the maps between 2019 and 2020. It's slightly reduced between the ante and post lockdown, like between February, March, and April. So the lockdown ranged around mid-March, mid-April. It is a so-called secondary pollutant, as you know. So the ozone present in the ambient air results from the photochemical transformation of pollutants under the effects of UV, of course. For the last one, and which had the most significant variation, is NO2, a common tracer of urban air pollution. As you can see here, NO2 showed a significant decrease compared to the period of February, so before the lockdown, when social and industrial activities were still operating normally. Its rate reduction was much higher than those observed for sulfate dioxide. This could be explained by the fact that like the emergency measures established in Morocco related to the cessation of industrial and transportation activities had a consequence and limited the NO2 emissions. So there is no doubt that the emergency measures and the containment imposed during the COVID-19 had positive effects on air quality in Morocco, and this is consistent with many findings of similar studies in China, India, and the UK. So this study is an incentive for scientists and policymakers not only to assess the impact of the outbreak on air quality, but like also for the effectiveness, or for its effectiveness as an alternative program of action to improve air quality. So before concluding, I want to shed the light on an initiative that was achieved by the IUC program, the Institutional University Cooperation Program of LAEUROS in Morocco. Colleagues from the cluster of competence on integrated water management was able to develop a dedicated COVID-19 portal using the ArcGIS Hub application. This portal provides continuous access to maps, data sets, videos, useful documents, and like nearby hospitals, comparison of case evolution between countries. Here you have the case between Morocco and Belgium. The distribution of confirmed cases between regions in Morocco, worldwide follow-up of the cases and deaths of the COVID-19, symptoms, measures to prevent the coronavirus, videos to raise awareness against the virus, and a QA forum to get information, vulgarized information about the COVID-19. So it was all from my side. Thank you for your attention.